Okay, start ಮಾಡೋಣ. So we finished all this, and yeah. So I was trying to give you a small activity wherein I asked you this question: what could be the probable female symptoms that we can expect in Trillium? So very good. There are a few answers coming up. Let me just read from the chat box. Okay. So there are a few answers that are coming up. Somebody says menorrhagia, absolutely right. Dysmenorrhea, fibroids, CS cervix. Okay. Any other conditions that you can think of? All big conditions. Yes, it can be used for abortions. Beautiful. It can be used for prolapse. Okay. Now, from what you are trying to, yeah, somebody rightly said DUB. I'm happy. DUB is a good thought. Menorrhagia is a good thought. Okay, and meteorrhagia is a good thought because this is a remedy which is predominantly a hemorrhagic remedy. Yes, beautiful. Dr. Swati, I mean, one Miss Swati says antepartum and postpartum hemorrhages. Good thinking. Happy. Okay, somebody says bleeding from CA rectum, CA cervix. Prashant says bleeding from CA cervix. Okay, any other conditions that you can think of? Good. See now your prime focus. Yeah, and Shashiraka says anemia. Good. See, anemia in Trillium will be result of all these things. Menorrhagia, metorrhagia, giving rise to anemia. Okay, anemia can also give rise to menorrhagia, metorrhagia. That's there. But in Trillium, menorrhagia and metorrhagia can give rise to anemia. Okay, so lot of inputs. Good. See now, what I want you to understand here is we have to primarily focus on all those hemorrhagic disorders. Okay, for example, you have antepartum hemorrhage, you have got postpartum hemorrhage, or if you start from menarche, you can see that a girl having menses for a long period or intermenstrual bleedings can be there. So menorrhagia, metorrhagia can be thought of. Somebody beautifully contributed abortions. Now, can you tell me in which abortion can we think of Trillium pendulum? There are different types of abortions. Okay, so yeah, somebody says incomplete, spontaneous. One more thing you can think of here is threatened abortions. Okay, so when there is a possibility of threatened abortion, the lady starts bleeding from her vagina, but the fetus, the sac is intact, but then there is a threat that she might abort. Okay, that can become an indication of a Trillium pendulum. Fine. So what is that you have in Trillium pendulum is any misstep, fine, can bring on the threat that she might abort. So in Trillium, please remember this. She has a feeling, or she might start bleeding from her vagina whenever there is this misstep. The only remedy you have in your materia medica is Trillium. And I don't know, shockingly, you missed menopause because that also comes under female. Now, what are those conditions where one can think of Trillium? Not everything you can think of Trillium. Any lady who walks into a clinic and she is of menopausal age, she has got menopausal symptoms, you can't blindly prescribe Trillium. Similia similibus curanter. So you'll have to match, you'll have to see what symptoms she is suffering from. In Trillium, she will have more of bleeding disorders. Yes, absolutely right. Menorrhagia, Rajesh says menorrhagia or metorrhagia, excess flow during menopause. I also gave you another indication. Menses become very often. Menses every 15 days during menopause can be Trillium. Okay, fine. So hemorrhages during menopause, absolutely right. And then there is this abortion, threatened abortion from misstep. And abortion, each remedy will have its own indication, its own pattern. Some lady may abort in first trimester, some during second, some unfortunately in the third. Late, later months she can abort. So we have got different remedies. I don't know if we have so much of time to talk all those remedies in detail, but I want to insist here that in Trillium, we discussed the abortion is mainly, or the hemorrhages comes from threatened abortion, or the abortion typically in Trillium happens during second or third month. During second or third month, okay? Abortion during second or third month, and we saw that anti-partum hemorrhages, postpartum hemorrhages. Somebody rightly said we can think of Trillium, okay? Yeah, fainting from hemorrhages, good, it's there. And we were talking of dysmenorrhea, somebody has contributed. In dysmenorrhea, each remedy will have a different location, a different character of pain, a different aggravation, a different amelioration, how they react in pain, how best they can endure pain. These are all few points that we need to ask the patient. So here, pain, as we discussed, is more in the back, is more in the hip, and they feel the back will break and they have to tightly bandage it. So this is what a lady typically has during dysmenorrhea, during labor. We can think of Trillium, and this is very important. Bright red hemorrhages. The hemorrhages in Trillium, they are not passive hemorrhages, they are active hemorrhages. So carbobage and other remedies, they have passive hemorrhage. Here you have more of active hemorrhage, and the hemorrhages that keep gushing. It's very fast, gushing hemorrhages. Carbobage, graphitis, they will all have hemorrhages which are very slow. Fine. This remedy, belladonna, this remedy, cocculus, they all have gushing hemorrhages. And any slightest movement can bring on flow in Trillium pendulum. Okay, flow profuse, gushing, bright red, and flow on least movement. And see, somebody contributed fibroids, somebody contributed CS cervix. My simple question for you is, can Trillium be indicated for fibroid? Can Trillium be indicated for CS cervix? Quickly, somebody. Now, Trillium is a very simple remedy, partially proved remedy. So from the clinical provings that we have, from the repertory we have, Trillium is not mentioned under fibroid. I repeat, Trillium is not mentioned under fibroid. Trillium is not mentioned under cancer cervix. But then when do we indicate Trillium? In fibroid, in cancer. This is a beautiful take-home message for all of you. Bleeding when it comes from fibroid or bleeding due to CS cervix, and if that bleeding is bright red and that bleeding is profuse, then you can think of Trillium. Trillium per se will not cure fibroid. Trillium per se will not cure cancer cervix. It's a very superficial remedy. It has got no power to dissolve a cancer or to dissolve a fibroid. This is very important. Somebody has requested, sir, mention the dysmenorrhea symptoms. So this is what you have here. That during menses, they might have this feeling that the hip, the small of the back will break into pieces. Okay. So hemorrhages from fibroid, and again a very good remedy for leucorrhea. And the leucorrhea which is copious, and the leucorrhea which is yellow, and the leucorrhea which is stringy. Fine. For this you can think of Trillium pendulum. And another beautiful indication here is varicose veins or varicosity during pregnancy. Okay, so varicosity during pregnancy, one remedy can be Trillium pendulum. Now, all these complaints in Trillium will be associated with the following symptoms, and these symptoms could be giddiness, it could be dizziness, it could be noises in the ear, or the pulse in Trillium could be very feeble pulse. So that's what you have to remember in Trillium. Okay. So fainting, a very important thing you have in Trillium. Now, why do they faint? See, each constitution can faint because of various reasons. I have told you in my previous classes, somebody can faint from the sight of blood, somebody can faint from seeing others in pain, somebody can faint from pain, a lot of things. Now, why do Trillium faint? Trillium faint because of hemorrhages. Hemorrhages after delivery are hemorrhages which typically comes from the uterus. Hemorrhages are they also faint from loss of fluids. For example, there is excess loss of fluids, and what is that fluid here in Trillium is blood. Somebody can faint from vomiting, somebody can faint from diarrhea. They are also vital fluids. In Trillium, they faint from excess loss of blood. They faint from meteorrhagia. So each remedy based on the affinity can faint because of various reasons. Trillium faints because of all these reasons. This is what I want to highlight here. Okay. So before I take up questions, the female affections of Trillium, they are very important. So you can start from the hemorrhages, you can start from the DUBs, the menorrhagias, the metorrhagias, the bleeding from cancer, the bleeding from fibroid, okay, and the bleeding from threatened abortion. What you need to highlight here is the bleeding which is bright red. That has to be highlighted. Okay. So do you have any questions? If you have any questions, I'll take up questions. Yeah. Or if you don't have questions, then we will move further and we'll see if we can take up some remedies for comparison. Yeah. Now I'll try to compare few remedies, and what are the remedies that I'll try to compare here is Acalapha indica, acetic acid. You also have China, Carbobets, Crotalus, Ipecac, Millefolium, Sabina, and many remedies. If at all you want, you can start adding and we'll try to differentiate. The first remedy, Acalapha, where blood comes from becomes very important. Here, the bleeding is mainly from the lung pathology. And one more PQRS of Acalapha is bright red bleeding in the morning, and towards evening it becomes dark. That is very, very characteristic. Please remember, acetic acid, more than the hemorrhages, there will be a lot of weakness because of hemorrhages. So when there is debility, when there is wasting, when there is weight loss, and all these things will be because of hemorrhages, the remedy that will come up will be acetic acid. China, again, a remedy with dark hemorrhages. It will also be associated with good amount of weakness. Crotalus, little things can bleed too much. Beautiful remedy for hemophilia, beautiful remedy for cancers where you have excessive blood. Dark hemorrhages, very important. And even the sweat is bloody is what they tell in Crotalus. Ipecac has bright red hemorrhages. Millefolium again has bright red hemorrhages. Sabina has clotted and partly fluid hemorrhages, which is very characteristic in Sabina. Okay. Now the clinical indications of Trillium. Actually, if it was one-to-one, we could have had a better interaction. We could have made this an activity. But this being an online class, these are all few indications where one can think of Trillium clinically. Okay. To sum up, I hope we have done justice to all the objectives that we had set in. Okay. In the end, I'll just share a small case and we can close the case. See, I had a lady aged around 48, 49 years old lady who you can see the report came to me on 1/6/2020. It's a very fresh case, recent case, and she had very bad bleeding, continuous bleeding. Almost 10 days she continued to bleed, and I had asked her to get a scan done. Before I started treatment, I thought I'll understand why is she bleeding so much. So she got a scan done, and scan shows bulky uterus with thickened endometrium. And one more beautiful clue what we got is she is a lady who is nearing to her menopause. My question to all of you here is, Can we prescribe Trillium in this case? Can we prescribe Trillium in this case is the question. Yes or no? Simple. Tell me yes. And if yes, we'll discuss why yes. Yeah, many of you have said yes. Now, if no, all of you are for yes, nobody for no. Now, people have told yes. Why do you feel Trillium can be indicated in this case? See, we can't practice homeopathy like this. You understand meaning? Just looking at the report, we can't practice. See, what is the small mistake we made? We did not ask her the character of bleeding. Is it bright red? Is it dark red? And in Trillium, what is that pathology that will bring on excess menstrual flow? It is fibroid. Do we have fibroid here? The uterus is bulky, but you don't see any growth here. Okay, so Trillium will not get indicated. So what is the take home message I wanted to give you is, please stick to the principles of homeopathy, take the case properly, and your remedy should be thoroughly matched, and then it has to be prescribed. This lady, when we saw the case, it looked, or the remedy that came up was lacasis. I'll share the details once you come back to the classroom, because I just prescribed lacasis. We'll see how lacasis work, because she had dark bleeding, she had a lot of other symptoms of lacasis, and then we prescribe lacasis. So please don't make the mistake of jumping and prescribing, because you're in final year, and next few months you will get the license to prescribe, and I want you to learn the right art of prescribing. So with this small case, if at all you have no doubts, you'll have a small assignment. Exam point of view, these are few things that can be important in Trillium, so please do prepare. I'll share the notes on the group so that it will be easy for you. And if you have no questions to ask, thank you for your patient listening, and we will close the class. China would be better prescribed. Fine. See, to prescribe China again, you should have symptoms of China. Okay, it will have a lot of weakness in China. Blood is more dark. Okay, blood is more clotted. Fine, and there should be a lot of weakness. Without weakness, you can't prescribe China. China should have weakness. Very important. Okay, so if you have no questions, yeah, then we'll close the session for today. And next Thursday again, we'll meet with a small and simple remedy. Thank you so much. Thank you. Okay, somebody says disturbed due to DM. Then one second. There's a small question. Sir, weakness of vision during menopause. What if the vision is disturbed due to DM? Very good. Nice question. See, in Trillium, you will not have any pathology associated. It's a beautiful question. For example, diabetic, for example, complications of diabetes. Fine. You have eye problems because of diabetes. Then this remedy will not come into picture. Okay, so there is no pathology behind the blurred vision. And again, see, why is it blue? We don't know. It could have been red, it could have been white, or it could have been black. In Trillium, this is a peculiar symptom. There is blurred vision, and during that blurred vision, everything will look bluish. I really don't know what the exact cause, what the underlying pathology is, but as per my knowledge, you will not have an underlying pathology in Trillium. A very good question asked by one of your friend. If it is because of DM, then you need to treat treat the person constitutionally. Okay, fine. So his sugar level should come down. A lot of other things should be taken care. Okay, good question. Any more questions? Chalo, you have a class. Don't be late to the class. Thank you so much. Thanks.